Assalamu alaikum. My name is Professor Dr. Azim Jahangir Khan, and today we'll be talking about rosacea. And the question we have a lot of questions that you guys have sent us over the number of months, and I thought that rosacea probably we have never talked about rosacea that much because after I moved to Pakistan, I thought it a more common disease in the West because I was in the US for my training for practice for more than 1.5 decades, for more than 15 years. And rosacea was very, very common in the West. But when I moved to Pakistan, I thought it's not a very common disease in Pakistan, India, and places like that. So I thought it's not probably necessary to talk about it. But now that I see quite a number of patients, quite a large number of patients about for rosacea, I thought probably it's the time to answer some of your questions that you have sent us over a number of months. So the first question is, what is rosacea and what are its causes and symptoms? Is rosacea contagious? Myth versus fact. Now, the myth is that rosacea is contagious. You can actually catch it from somebody else. So before we go into that, let's just talk about rosacea in general. What is rosacea? Rosacea is a sister disease of acne, in other words. So it's very similar to acne. So it's like pimples, but they are more in the center face. So in the center of the face here, in the T zone, the center of the face gets affected with rosacea more than the rest of the face. So center of the face gets red, there are pimples, there is itching, sometimes there is dryness also. But typical rosacea is central facial redness along with pimples. And whenever you go out in the sun, you get flushing, blushing. Whenever you eat something that can cause rosacea or flare rosacea, for example, the most common foods that can flare rosacea are alcohol, very hot and cold weather, um, the foods which contain carbonated beverages like soda, coffee, smoking, extreme hot and cold, as I told you. Some people get rosacea when they are very excited. Um, or they're very sometimes when they're very mad. So all these symptoms, and there is a whole bunch of other triggering factors, but these are the main triggering factors of rosacea. Now, whenever people have rosacea, these factors can trigger it. And one of the most common thing that occurs in Pakistan is using whitening cream. So most of the whitening creams, unfortunately, in Pakistan contain steroid or mercury. So there is a beautiful report, published in medical journals, one of the medical journals, I think a couple of years ago, in the medical dermatology journal, that about almost all the whitening creams in Pakistan, except a couple of them which do not have steroid, almost all of them have unfortunately steroid. So steroids can cause rosacea, and we call it as steroid-induced rosacea. So rosacea can be caused by steroids, which is common in Pakistani made whitening cream. But some of the Pakistani made whitening creams, and I have actually considered for a few companies who asked me to develop some whitening cream which does not contain steroids and mercury, and we have done that successfully. So there are safe whitening creams as well. So these are the common causes of or exacerbating or triggering factors of rosacea. So I had told you rosacea. What does it look like? Now, what is the common age of rosacea? Now, common age of rosacea is usually the younger adults or adolescents. But interestingly, rosacea can happen in middle-aged females, middle-aged men, elderly female, elderly men, and even in the children also. The youngest child that I've seen with rosacea is about, I think, 6, 7 years old. Female that I saw in my clinic 2 months ago. And the reason was because she was having eczema for which one of the doctors prescribed her steroid, and the steroid caused rosacea. Next question is, what foods should I avoid if I have rosacea? Now, as I just explained it to you, that if you have rosacea, do not eat any food with a lot of condiments in it, a lot of spices in it. So spicy food, um, carbonated beverages like Coke, Fanta, 7 Up, something like that. Don't take a lot of coffee or tea. So those are the and don't take alcohol, of course. So those are the triggering factors in food for rosacea. How do I know that if I have rosacea or not? So if you have pimples in the center of the face, and when you go out in sun, or when you get excited, or when you eat certain foods, you get central facial redness, blushing or flushing, then you probably have rosacea. Now, what causes rosacea? Rosacea, as I told you, that sometimes the steroids can cause rosacea, some foods can trigger rosacea. And if you have family history or in your personal history, you have had, for example, acne when you were young or adult, now at the age of 40 or 50, you start to have rosacea. It means that you had propensity for acne as well as for rosacea. What are the common symptoms of rosacea? As I told you, that having pimples, having redness. For some people feel very hot when they go out in sun, and they feel very hot and tenderness. They're right in the middle of the face. So they think that as if heat is coming out from their face, the red area of the face. So that is very common symptom of rosacea with pimples, of course. How can how can the rosacea be treated? Now, rosacea is very easily treatable condition. So, rosacea can be treated very easily with topical medication. Sometimes we have to give you oral medication, and it's a disease. It's not a beauty concern. Some people think that it's a beauty concern and they go out and they start buying the beauty creams. You don't need that. Rosacea is a disease which can be easily treated. So I think that's pretty much about it. If you have any further questions, you can always shoot an email or message or in the comment section. You can always leave a comment in the form of question, and we'll be more than happy to go through all your questions. Hope I hope that you enjoy these little sitting. And the whole purpose is to educate you about the diseases which are easily treatable but often ignored. Have a nice day.